Welcome to Your Health. I'm Dr. Richard Usatin, a family physician. Our guest today is Dr. Edward Sheldon, Director of Integrative Health Services in Santa Monica. Dr. Sheldon specializes in the area of behavioral medicine and psychology.
First, they have to be comfortable with the idea of responsibility. The biggest difficulty that people have about taking responsibility is they then feel guilty for their entire life beforehand. They said, you mean last year when I had this problem, what happened 5 years ago, you mean I could have done something about that? And it's very important to give people permission to be very self-accepting. Not only permission, but encouragement to be very self-accepting, to relate to the body in a loving way, to be forgiving of the self. Because if somebody's back goes out, and they're angry at their back because they're not able to go skiing, or they're not able to play tennis. And then they get angry at their back, what's wrong with you? Why can't you get better? And they create an adversarial position with their body. Then, of course, it creates tension. And it creates physical tension, and it's more difficult to heal. If a person can accept himself or herself where they're at right now and say, well, I've always done my best, and I come from parents and grandparents, and they're this in society, and I had this teacher in 5th grade, and I feel the way I do about myself, and to start in a place of self-love and self-acceptance, not a place of narcissism and just me, but in a place of realistic self-love and self-acceptance, and to say, what can I do with my body? Not that my body is a machine. How can I get it to go beyond what's even healthy? You know, how can I run a million miles in a day without ever running out? It's not appropriate, it's not healthy. But how can I get my body to perform well in a partnership and take that kind of responsibility? Then the person can actually have a sense of increased self-esteem and feeling good, because they're able to have their body respond for them and with them, and stop having the tension and the pain. The other thing that's very important is that when you identify what the secondary gain is, if a person's headache, for instance, is a way that they deal with keeping distance or avoiding conflict, if you teach that person how to deal with conflict, they don't need to have the headache anymore.
Now, earlier we did a tape of a biofeedback demonstration, and the purpose of that was to be able to show the connection between the mind and the body. Can you comment on that?
Yes, it's very, very important for the viewers to know that what you think, even words that are said in your environment, actually affect the physiological processes in your body. That a particular word, everybody who is watching this show knows that there's a certain word or a certain thought that will make you sick to your stomach. There's a certain thought that will put a smile on your face. And it's very important to be aware of what your cues are, of what your reinforcements are, what are the stimuli that will evoke something positive in you and something negative in you. If you have something that's in your environment that creates a negative response inside, then you need to learn to recognize it and then decondition the response so that you no longer have to have a negative response. Similarly, it's important to program yourself in terms of positive responses, that you can tell yourself, if you're at the job and your boss is critical, there's something you can tell yourself or think about that will give you a good feeling about yourself so that you are more in control over your own feelings rather than just being reactive rather than responsive to whatever's happening in the environment.
So should we show that segment?
Yes, let's take a look at this now.
That would be great.
One of the important things that we do at Integrative Health Services is we teach people how to recognize signs in their own body and how to gain a sense of mastery over their own responses. Oftentimes, in fact, most of our patients are referred to us by their primary physician for a medical problem. And most people are not aware of just how much their mental state, their mindset, and their emotions affect their physical health. Here we're going to have a short demonstration with a gentleman by the name of Elliot, who I just met this morning at the studio. It's his first day here at work, as a matter of fact, and I've asked him to do a demonstration for us so that we can show you just how easy it is to use biofeedback equipment to learn about yourself and to gain mastery over your own responses. Here is a machine that gives you auditory feedback. You can hear the sound. It gives you visual feedback so you can see how you're doing. And it measures basic anxiety levels in the body by being connected to 2 fingers, measuring skin conductance having to do with physiological responses in the cells of the body, in the sweat glands. You'll see that a sudden sound, a sudden potential environmental threat in the environment will create a heightened sense of stress. If I went to just touch him anywhere, I'm invading his own personal space, and you'll see also a heightened response. Now, people say, well, okay, here I am doing something physical, but is it really true that just thoughts can affect our bodies physically? And so what we're going to do is just say a couple of words to Elliot and see how he responds on a physical level just to the thought, just to the idea of the words. Being that it's his first day at work, I'm sure that he might be concerned about. Before I say what it is that I think he's concerned about, there was an elevation in the stress level because I don't need to give an analytic interpretation. He knows inside himself what he's stressed about. And so if he can just ask himself what he was thinking when his stress level went up, then he will gain some insight, and he can learn how to decondition that response by simultaneously doing a relaxation exercise while having a stressful thought.
Dr. Sheldon, would you like to comment on the insert that we just viewed?
Yes, the insert was just done immediately before we started doing the show with a total stranger, and the nice thing to be aware of here is that a person who has no previous experience in biofeedback training can just be hooked up immediately without long-term therapy and to see right there and then what their responsiveness is, what are their stressors. And sometimes a person can go to conventional psychoanalysis and really never get in touch with that, or maybe they'll get in touch with it way, way down the line, and they won't make the connection of what's going on physically in their body. It's really very important, and that's why we call the Center Integrative Health Services, to really integrate what's going on mentally, emotionally, physically, spiritually, sexually, what's really going on inside the self. The nice thing is that a person can go inside himself or herself and learn about their own being. And in today's culture, things are, on the one hand, very narcissistic, and on the other hand, very outer directed. And there's very little time for people to just sit quietly and go inside and take a look at what's going on inside, and to be able to have the confidence. And it's a wonderful thing when people come in, and a lot of the patients that we see have gone to 20 different doctors, and very often the patients who are referred to us, I just got a call, for instance, a couple of months ago by a rectal surgeon who sent a patient to us who had a problem for 14 years and said, Dr. Sheldon, I really don't know what to do with this patient. And we utilized hypnosis, medical hypnosis, and biofeedback. I do a lot of medical hypnosis as well. And in 7 weeks, this person did not have the problem, was off of the medication. She was taking Senecot for 14 years, would only be able to alleviate herself in the bathroom maybe once every 2 weeks or 3 weeks, so she would get very distended and then have pain and bleeding. After 7 weeks of treatment, she was completely off of her medication, not having the problem. And unfortunately, just 2 weeks ago, she was hit by a car crossing a crosswalk. And I saw her in Cedars, and she was already proficient in the use of self-hypnosis and biofeedback. And so we utilized it there to stop the pain, to reduce the swelling, and increase blood flow to her leg. And so it's a very nice thing for people to, in terms of increasing their self-esteem, to realize that they don't have to be totally dependent on outside sources for healing. That most physicians will admit that patients who have a positive attitude certainly respond a lot better to treatment than patients who don't. I'm saying that you can learn to be a partner in the healing, because sometimes people blame themselves. So they say, well, I just got hit by a car. How did I create this reality for myself? And I'm not suggesting that you do that. I'm suggesting that whatever reality you're faced with at the moment, that you utilize as many as your own resources internally, as well as one good internal resource is to know who's the right medical specialist to call to have you checked out. Mm-hmm. And that's also important, to know how to ask a doctor for help. So I'm very clearly saying that it's important to integrate all different kinds of medicine, and to be able to be a partner and not just give the responsibility to a doctor and say, here, you solve the problem, but that really the patient has to be part of the healing alliance.
Now, how do you actually make use of hypnosis and biofeedback in the treatment of someone who has a problem that comes to you for help?
The kind of hypnosis that we do is very different than 90% of hypnosis done in the field. Most hypnosis is direct suggestion. The hypnotist induces a state of hypnosis and says, you will do this, you won't do that. And we really don't work that way, because I am in the philosophy that the patient needs to learn responsibility and how to help himself or herself. So the way we use hypnosis is we help the patient to find out what the causes of their problem. We use idiomotor signaling, in which the brain responds in a nonverbal movement of fingers as to whether there is a psychological component or not. If the brain tells us that there is a psychological component, we look for it, and the unconscious mind will reveal what it is. If the brain tells us that there is not a psychological component involved, then we let it be treated simply by physical medicine. The important thing is to be able to have the patient learn how to use hypnotic abilities, which everybody has, to be able to find out inside. In fact, not only do people tell you in hypnosis what the cause of the problem is, but they will often tell you on an unconscious level what they need to do to solve the problem, which is very beautiful, because very often doctors are searching for the answer. And sometimes the patient really knows what they need for their own healing. And what you might want to do, those of you who are viewing the show, is just to take a moment and to take a deep breath, to notice how you're breathing. Are you breathing just in a shallow way, or are you really taking air into your body? See how your muscles are. Are your legs crossed? Are you holding in your neck? And just see how much love and relaxation you can give your body, and feel how much better you can feel when you pay attention to yourself. As I say to our patients, if you pay attention to yourself, you won't have to have tension. Better to pay attention than to have tension.